The following portion of Living Local DMV is sponsored by Ashburn Children's Dentistry. Welcome back. Parents are often told not to think about orthodontics until their child turns 7, but by that age, habits like thumb sucking, mouth breathing, or poor tongue posture may have already affected their health. Today, we'll explore why the earliest years from 0 to 7 are critical and how early intervention can help prevent the needs for extractions, headgear, or even jaw surgery later. Joining me now to share their expertise are Drs. Krystle and Dr. and Dr. Lynda Duru. Welcome, ladies.
Hello.
So this is such an important, it's always a pleasure to see you first and foremost. But this is such an important topic because I know so many parents think, I'm good until 7. I don't have to worry about all these things. Oh, they suck their thumb, no big deal. Dr. Krystle, tell us why it's so important that age 7, but before age 7, and what parents should be looking for.
So it is something that everybody grows up knowing. Okay, you get braces when all your permanent teeth come out and start looking around age 7. But there's certain habits, there's certain functions, different foundations that aren't being built earlier on, like how we breathe, how we chew, where our tongue lays, like you described in the beginning. Those are affecting how our jaw grows. And so what you see by age 7, what you see by age 10 or 11, those are just the results of not having good foundation.
So it's the results, but we want to know what the good foundation is. So Dr. Lynda, what should parents be looking at before age 7 that they might not see automatically?
Well, they may not know that the children's teeth that are crooked or not having spaces there is not good. And they may not even know that the low tongue posture, the open mouth is not good. And they may not even understand that if they're not chewing properly, they're not chewing hard fibrous food and just getting soft food, that makes it hard for the jaws to grow, as well as if their mouth is open a lot. So all of those things are important because otherwise the tongue is not going up to shape the palate. And when that doesn't happen, your teeth get crooked. And if you don't chew in properly, your lower jaw doesn't grow well, then you don't get enough space to breathe either.
And we don't want to have to take our kids to have to get headgear, because that sounds like a whole other battle, and I see a lot of dollar signs behind that.
Yes.
Dr. Krystle, what I love about you and Dr. Lynda is you always have a good chart to explain things to those of us who do not have the education and expertise that you have. So you have a chart that explains the classic problems to watch for in 7-year-olds. So can you walk us through this chart?
Sure. It's a really good teaching tool. It's a visual. I think it's right before this, but yeah. So it's a visual of the way the teeth look, oftentimes with it's protruding or very crowded, or they have underbite, overbite, the sucking habits, and just the teeth just look just weird for lots of parents when they see it. And that is, for us and for many providers, it means that that's the result of the foundation not being built and certain habits that have caused it to look like this. And so it's not to scare anyone, but it's just to say that it's best to intervene earlier so that way orthodontics, which is just about aligning the teeth, can actually be more stable versus having to use more efforts like taking out permanent teeth, like using kind of really devices that are harsh like the herpes appliance, or as far as getting surgery, or even for most people, which is multiple rounds of braces, that alignment or the foundation wasn't built first before the alignment was built. Or before the alignment was done. And so that's why it's really important to have earlier intervention and obviously even start fixing things like some biological things, like that's a hint when you're not sleeping well, things like that, beforehand.
So intervention and prevention.
Yes, right.
Dr. Lynda, I want to ask you too, do you all have to work hand in hand with the orthodontist? Do they see you first and then, a little less money has to go to the orthodontist? How does that work?
We love our orthodontic colleagues now.
Partners, we're all
team,
partners.
Not turf, you're right, absolutely. Well, our role starts early. For us, when a baby doesn't even latch properly, that's a sign that we better be watching out for how well their jaws are going to grow. So we want to learn we want to make and get a good foundation so we have good jaw growth, and that way when the orthodontist is coming later, they can align the teeth in good juicy bone, and that way the teeth are healthier for a longer time, and you have less chances of needing to have multiple rounds of braces, because we would have already trained the muscles, how to breathe properly, so that there's a balance between the jaw and the teeth and the tongue.
So what I'm hearing is that I see you and I save money later on, in time and effort, a lot of things.
Yes, exactly.
Save the kids orthodontist and a headgear and all types of things. So
pain and discomfort.
Pain and discomfort, very important. So ladies, before we wrap up, I have to ask, what do parents need to walk away with? What do they need to be watching from ages 0 to 7?
Okay, so at least from this show, I want everyone to know you want to get your foundation first, then alignment next. And if their child is having any issues with bedwetting, grinding, you can already see the baby teeth being crooked. They're snoring, prolonged finger habits, pacifier use, things like that.
Or toddler drooling.
Yeah, drooling, excessive drooling, things like that. And just if any of those things, and this will be a great screen to take a screenshot of, any of those things, 2 of those start to come in so we can evaluate it. That is the start of a journey where we can help early on.
And I feel like every parent will need your help, no matter if they're perfect teeth or not. If you can get more information at KidSmile, that's KIDZ smile.com. Ladies, thank you so much. A wealth of knowledge. My tuition money is in the mail. It's always coming. Thank you so much.
It's our pleasure. Thank you.
Absolutely. The preceding portion of Living Local DNV is sponsored by Ashburn Children's Dentistry.